So I have some slides. I don't know if the clicker here. So thank you. I thought it would be useful to just have a visual, since we are a rather visual company, and returning information to patients and the participants for us is very important for us to be able to show that. So thank you for having me here. I'm delighted to have the opportunity to talk about something that's really important to patients like me. One of the things that we started with when we started this company in 2004 was the notion that people had information to share, and they needed a place in order to be able to do that about the experiences that they were having with their illnesses, with the treatments that they were taking, and of that nature. And so the company was built on the whole notion that it was important to gather this data and to put it into some perspective that could be shared back. So at every point in time, we are always thinking about what is our give something, get something strategy. So if a person is actually willing to participate on Patients Like Me, we take the responsibility to understand that we need to find ways of taking the data that they've provided and generously shared and making some meaning out of it. So the strategy really at the time was rather novel and disruptive. The whole idea that patients would actually be sharing medical information back and forth with each other, and they would be open and transparent about that, was really somewhat anathema to the thinking that most of us have in healthcare, that we don't share that kind of information. And we've learned over the years that patients are not only willing to share this information, but want to share it and also want to learn from it. So I just put this up here quickly to give you an idea of the kinds of things that we look at when we begin to consider anything that we do with the data that patients provide us. And I want to just separate the data a little bit. One is profile data that patients just add into the system using the tools that we provide for them. And it results in what you see there, that profile visualization. It happens to be Stephen Haywood's profile. And the demonstration of what that shows is how his experience was longitudinally plotted over time based on the data that was provided by him and his family as part of his experience living with ALS. Now, we have 530,000 members who have profiles like this on the site, representing about 2,500 different conditions. So our goal really was to find ways of being able to collect the data, measure it in some way that would actually give it some validity and some understanding, so that patients would be able to look at their profile and maybe look at another person's profile and have some way of being able to compare and contrast that. Aggregated so that we could actually also give back community reports. So we were able to give that information back in a very visual way, and community reports that talk about the condition, but also reports that talk about the treatments people use and their experiences with that. Then the other parts of this really come down to us being a research-based platform first and foremost, but we're built within a social network, so this idea of connecting is incredibly important. So we had to find ways of generating new information, new insights, and translating that into something that could be shared. So that's really the give something, get something notion, so that every project that we do, we create a give back or a return of results strategy in the statement of work that we're creating, whether it's an internally initiated project or an external one where a partner has come to us and asked us to think about doing a scientific project with them to answer a particular research question. So that research question with them we would sit down and say, well, what would we be expecting to learn, and how would that information then be important to give back to the people who are going to be participating in that. So it's very clear right up front in that protocol what that strategy will look like. Now, for over 10 years, we have been collecting patient-generated data, and so the data that we have that's on the profiles are one thing, and then we might do a very protocol-driven research study that's going to ask very specific questions, so that's a different type of data. And then we also have a lot of qualitative data, so we do a lot of analysis on the kinds of things people just talk about in the course of their conversations with each other on the site. We have moved this year into something that's rather novel for us. We are now starting to collect biospecimens. And so we have now started to think about what does that mean in the context of this alliance that we are now a part of, which is actually collecting information across a multi-omics platform. So not only genomics, but we're looking at proteomics and the microbiome and a whole host of other ways of thinking about the ways that people express disease in their biology. So part of our work with this alliance, many of them who are pure scientists and have never left left the bench and haven't really worked with patients directly, are working with us to figure out how do we then begin to take this data that we're starting to collect and find ways of meaningfully giving it back. We're starting this project with some very syndromic conditions, ones that we know well, in large populations that we have on the site. And we're doing it with much intention, and that's my point. What I'd like to leave you with is an understanding that you can create a return of results strategy that's participant-centric and should be, but you need to think about it ahead of time, and you need to think about what are the kinds of questions that most patients would like to have answered as a result of the data that you may be generating and gathering. And as we go through the course of the discussion, I'll share a few other thoughts on how we might make recommendations for that, but I really wanted to share with you just the ways that we have done it in terms of some best practices we have used and how it gets incorporated into everything we do. And that give back strategy that we create includes our entire multidisciplinary team. So it would be engagement, design, engineers, data scientists, research scientists, and clinicians. All are a part of that strategy development, and it's an important component of how our participants then can trust that the information we give them back has some relevance to the kinds of questions that they have. Lastly, participants are always a part of those discussions as well, so we get that strategy input from them. So, thank you.